Hey everyone, I hope you're enjoying all of our videos for the 250th anniversary of the Battle of Alamance virtual event. For this next video, I wanted to shed a little bit more light on the medical personnel, the surgeons and surgeons' mates, and the nurses that were hired by Governor Tryon and utilized during the militia campaign against the regulators. To join me in talking a little bit more about this part of the story is Alamance Battleground volunteer and living history medical interpreter, Chris Grimes. Chris, hey, it's good to see you.
Uh, Thanks for inviting me to be part of your digital program this year. You had an awesome program last year. I
Thank you.
really look forward to this year's program, and really um, quite humbled to be part of this one, because I know this year is going to be just as awesome.
Well, yeah, the stuff that you and Mike Williams do is, one of the more popular living history elements that we have at Alamance Battleground and at all of our sites, to be honest. And so we really would be remiss if we went through the 250th anniversary without really giving medicine and surgery its due. And so I really appreciate you joining us. Now, I talked with Mike. His video is going to play tomorrow, but I talked to him about surgery mostly and the battlefield medicine and what was happening immediately after the Battle of Alamance. But, we go through the primary sources and you see that Governor Tryon really had a good understanding of the importance of health and the importance of the medical profession. If you go through Tryon's camp rules, where he lists all the rules for the campaign, everything that the soldiers are supposed to do, not supposed to do, there are several in there that have to do with health and hygiene. And so obviously, in the 18th century, people don't really know what germs are, but there is some ideas about cleanliness. What would you say people knew about health and medicine, and also what did they not know in 1771?
Well, and I think you hit the first thing you talked about was the idea of there was no germ theory, and I think that's the key thing. Even though that you can go back to the mid to late 1600s, and you can see people like Robert Hooke that described the structures of a mold. They were looking through rude, crude microscopes, and they could see some of these creatures or whatnot. They really didn't understand that these were the cause of the problems versus what they were trying to attribute it to, either the older style of medicine, which was the balancing of the four humors, black bile, yellow bile, blood, and phlegm. The idea that it dealt with it incorporated your personality, it incorporated astrology. Then you had the idea of, and really where we kind of still focus on in the 18th century, because we're getting away from humors. We're focusing on the miasmas, the miasmatics theory. It's bad. So that's kind of the driving force of disease. You're beginning to see a change as people are thinking more about inflammation, and they're getting away from those humors. Um, and some of your physicians and your surgeons are really beginning to, how I want to put it, their eyes are, it's during the age of enlightenment, so their eyes are, the scales are falling off, and they're actually beginning to see things. Now they've not figured it out, and they won't figure it out to the 1860s until you have Louis Pasteur and you have the great Joseph Lister, who do their seminal work and their seminal studies that further develop germ theory and antiseptic surgery. But it really, that's the focus. They just did not understand why they got sick. And again, this period, they're focusing more on external causes. And you're, the interesting thing when you look at Tryon's his orders, and you drift into a book written by John Pringle, Dr. John Pringle, who was the physician general of the British Army. He wrote a book, uh, basically, it's actually called Observations of Diseases of the Army in 1752. Um, he actually begins to develop. You start seeing he's looking at the external influences, and a lot of what he's saying in his book is what Tryon's saying. That's what it's kind of pushed. It, you know, when I first think of health and hygiene, that's where my focus goes is to Pringle's book, and he gets into the idea. He identifies the fevers and dysentery and gel fever, which we know as typhus. He identifies those as your major problems, and but he was still wrong about how it was transmitted. It was transmitted, he thought, by putrid air, which we know different.
Mhm.
Mosquitoes, fleas, things that they lice, they cause problems. And those are things, if you're going through Tryon's orderly book, he gets into. He's driving this idea. Okay, when we go to get water, let's get water upstream from where the horses are being forded, or even where we're washing clothes or washing ourselves. Yeah, it's a good idea. We do need to take some sort of bath every so often. Um, you need to comb your hair. I mean, it's stuff today we take for granted that we as little boys we didn't want to do when we were little, but yet during the summertime, yeah, we were made to come in and take our baths and put on clean clothes and that sort of thing. And it's the same concepts. But again, you're dealing with an 18th century mindset, and in fact, that's almost one of the things that Mike Williams taught me is his student, his pupil, was the fact that you have to kind of suspend your knowledge of 21st century medical ideas, surgical ideas, and try to put yourselves in the shoes of the 18th century person. Because otherwise you're sitting there scratching your head saying they couldn't figure this out. Well, no, they hadn't figured it out yet.
Yeah, there could be a lot of presentism if you have much of an understanding of 21st century or even 20th century medicine. And
Yeah,
it seems like that the 18th century is so fascinating because they seem tantalizingly close to understanding the whole thing because they know what the problems are. They know what the illnesses are. They're just not quite getting the causes of the illnesses quite right. And so they get really close, like they do things that help, but I think in some cases they don't even know that they're doing things that are actually helping their own cause against disease.
there's a book by William Northcutt that Mike had me peruse as I was getting into this side of the hobby, and it talks about taking the sails off the ship and wetting them and putting them on the land side of your camp. Where you're thinking, what? Why do you do that? It's a barrier against mosquitoes. But they didn't understand mosquitoes was the carrier of malaria, or as they described it, an intermittent fever.
Mhm.
And it helps. I mean, and it's what it is again, it's common sense. They just haven't put it all together. But we're beginning to understand, you know what, if we put the human body in the right condition, the right environment, it may very well heal itself. We may not have to operate.
So let's get into a little bit more detail because the Alamance campaign is so well documented for an 18th century militia campaign. We even know the names of and the extent of the medical staff. So when Tryon starts his campaign, he has two surgeons of the army with the rank of lieutenant, Thomas Haslin and Thomas Cobham. And then he also has a surgeon's mate named William Matheson. And I think it's safe to assume that Tryon is thinking ahead to a military conflict, wanting to have medical staff that are going to be able to address battlefield wounds after any kind of confrontation with the regulators. But what would the role of those surgeons to the Army, that surgeon's mate, what would the role be just on a daily basis as they are marching, as they're undertaking a military campaign?
Well, they would. One of the first things they would be doing is they would be conducting sick call every day, and identifying the problems that may be existing out there with the different soldiers. Because when you gather that number of people together, and you think of Eastern North Carolina as still, and that's where the bulk of them came from. You're amassing all these guys together, and you're going to have disease. You're going to have problems. And so you're going to be treating those along the way. You're going to be bringing the sick with you. So you're going to have sick call. And that's where, your surgeons mates, they get into your surgeons are taking care of the nuts and bolts and diagnosing and telling the surgeons mate, this is what we need to do. The surgeons are probably making the medicines. It depends on the expertise of the surgeon's mate, but they'll be training him how to make a lot of these medicines, and he will be helping them with the distribution. In fact, he'll really be focused on the distribution and of the meds. He's going to be seeing such things as you're going to be seeing intermittent fevers. And intermittent fever is, if you look at it, it's textbook malaria. We didn't call it malaria, but that's what it is. Where you'd have a fever, it would run hot, but it would fade away, and it would come and go. And every time it would come and go, it would sap your strength further and further. In fact, understand malaria is a parasite, and it's transmitted by mosquitoes, a specific breed that carries it, believe it or not. But it would be transmitted. And pretty much anybody that's been in coastal North Carolina has been exposed to mosquitoes, and more than likely they've got it. And so you'd be combating that. Luckily, you had tincture of the bark, which is essentially the rude crude version of quinine. It's where it comes from. Now, the bark, it comes from the cinchona tree or cinchona tree, found in Peru, Ecuador, that part of South America. Um, it's that bark contains several different alkaloids, but one of those alkaloids is quinine. And you make a simple tincture, which is alcohol. You use 200 proof alcohol. You use it as a delivery agent, but also as a processor, because you're going to add so many ounces of of the bark into the alcohol, let it steep for 7-10 days, and you get this dark brown liquid. And it tastes horrible, but it's super effective. In fact, guess what? It's the same stuff, except it's much more refined, or it's made synthetically, that we use today to combat malaria. And it's why malaria is really non-existent for us here in the United States. Well, that and the fact that we sprayed and killed all the mosquitoes, and kind of ended that life cycle once we figured it out. But we have quinine. Your other problem would be dysentery, and that has to do with bad water, bad food. What you're going to be using there is you're going to be using one of derivative of opium. I say derivative is really it's the power. If you think of paregoric, and if somebody had diarrhea, paregoric would probably be the first thing I'd give them. That's a very low dose opiate based medicine. It actually contains several other chemicals, including aniseed oil, benzoic acid, among others. And if that didn't check it, then you would start administering tincture of opi, which is nothing but laudanum. That's the common term for it. And you'd be giving, and it's pretty potent. When we make it in this period, we're making it pretty potent. So we're giving it.
So I've heard.
Yeah, well, I mean, you would think you see these movies, they're taking swigs of it. No, 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 no. We're giving it in drops, literally drops per hour, or drops so many drops in so many hours. So that's what you're kind of dealing with there. But we would try to stop it before it got to the bloody flux. Because if you get to the bloody flux, what's literally happening is your entire digestive system, and specifically the intestines, are hemorrhaging. And it's nothing but blood coming out. That's it. And if you're to that point, you're probably not going to survive, to be honest. So we know he's going to be dealing with that. We know that because they had been exposed, and looking at Tryon's orderly book and looking at his what's going on, we know the weather they're experiencing, cold, wet. We're also going to we'll see bronchitis, pneumonia, also cold, just a simple cold.
Yeah, well, actually, we'll talk about that in towards the tail end of this, because I do want to get into one documented instance.
But that's all that we're getting into. We're getting into all of that's what they're facing.
And that's why this is such a rich conversation, is because the documentation is so rich. Yeah, and that also includes documentation of that medical staff expanding after the Battle of Alamance, when they have no less than 60 wounded people that they are caring for. And then there are some accounts that say that wounded regulators are being taken back to the militia camp to receive medical attention as well. Try and make sure to do that. And on May 18th, it's noted that the surgeons of the Army are directed to hire women to serve as nurses. And that's a very interesting access point to the role of women in medicine during the 18th century. So could you talk a little bit about, both in the military setting and in the civilian setting, what role do women play in health and wellness?
You're going to see in the armies of this period, in the wars of this period, you typically see you'll see camp followers. So you have some of those issues. Not as much so with Tryon's army, because it's more of a compact war, and it's really not. It's an armed conflict. It's more of it's a police action. I mean, this to some degree. So you don't see the followers like you would see it in the
Revolutionary War.
Revolutionary War. Yeah. So you wouldn't see that, but the role of women would be doing the chores that, say, of an orderly would take care of. You would not see them getting involved in serious medical care. That's not that's not where they're trained. That's not what their ability is focused on.
So it's still a very male-dominated industry at that point. There's got to be a little bit of gatekeeping going on, probably.
One instance, there was a surgeon during the French and Indian War that his wife came along with him and was actually the matron for his hospital. And the matron is really the head nurse. Okay, he died, and she literally took over. But she had worked by his side for so many years prior to the war, and during the war, she knew what to do. So you have those instances. Getting back to Tryon and what he was seeing, the ladies would have been brought in, and they would have been paid to basically take care of the daily menial. I don't want to say menial tasks, because they were needed tasks, because you need somebody that's going to help take care, help wash the patients. Is going to help change the bedclothes, help change the mattresses, if you will, straw and whatnot. They would be helping feed the patients and helping prepare under the guidance of the surgeons made, helping prepare the food for the patients. Because a lot of those patients, we would, as a surgeon, we would have put those on a light diet. They'd have been eating things like oatmeal gruel, a broth, that sort of diet. actually no different than what you get when you go to the hospital these days.
That's right. Yeah, and actually, again, to go back to the documentation that we have, there is a receipt that's submitted, I think, by William Mathewson for the food that he is giving to some of the patients, and it's like it's I think soft bread or like fresh bread and tea,
Hmm.
and I think milk as well.
Hmm.
But so it's very very basic, staples,
Yep,
and definitely a departure from the like pork and cornmeal that
exactly.
constitutes the military ration for the soldiers who are still out in the field.
And they knew diet played a role in the patient's recovery, and they knew that the patient couldn't digest, being that they're sick, they could not digest these heavy foods, so they had to put them on something light, and that's where you got into to the gruels and to the broths.
After Alamance, you've got this overextended medical staff. They hire nurses to help allow them to, be able to run a field hospital by the
Mm-hmm.
militia camp. But Tryon still has to get into the backcountry and put down this regulator movement. And so only a few days after the battle, they leave the wounded. The rest of the militia
Mm-hmm.
goes. And almost as soon as they leave, and they go out into the Sandy Creek area, they get hit with like 8 straight days of rain. It rains and it rains and it rains, so much so that Tryon's campaign journal says, I forget what date this is, but they note continued in camp, much rain. It having scarcely ceased for 7 days. So this is probably around like the May 24th, May 25th, and the men having no tents or anything to shelter them but boughs and the bark of trees, near 100 were seized with pleurisy of fevers. So take me through what is actually happening in late May to that militia.
Okay. I'm trying to recall. Did they mention temperatures? Did he mention temperatures?
Pleurisy of fevers.
Just saw
No,
pleurisy
nothing.
fever. Well, no, I'm not saying. I'm talking about the air temperature.
Excuse me,
Air
air
temperature.
temperature.
Did he say it was cold? I can't remember
No,
from.
no. Yeah, there's nothing that speaks to the temperature of the weather besides rain.
More than likely, what he's dealing with is no different than what we would be dealing with if we were dragging through the swamps and the underbrush, the backcountry. If we were ourselves following his trail like he did, he would be dealing with colds. He would be dealing with pneumonia. He'd be dealing with bronchitis, probably some sinus infections in there. Um, and all of those, that's what they would be treating. And it would be a lot of, we're in that period of time. We're still using some of the heroic treatments like bleeding and purging. There'd be a lot of bleeding and purging going on. There'd be a lot of guys that would be taking the tincture of the bark, because you gave the tincture of the bark not just for your intermittent fever, you gave it for all fevers. And sometimes it worked and sometimes it didn't. So they were dosing out plenty of tincture of the bark. They I mean, that's kind of where they were going. There'll be some medications that may include camphor. They may be doing, if there's fluid in the chest, they might be trying to do some counter irritants, creating mustard plasters or plasters made from cantharides, which are the Spanish fly, extremely acidic. Trying to cause blisters, thinking that they're pulling fluid out of the deep tissue, but they're not. It's really the surface tissues. I mean, and
Mhm.
just under that. Um, so all of these treatments would be going on, but mainly it would be a lot of tincture of the bark, a lot of purging, a lot of bleeding. Yeah, yeah, it just wouldn't be
That's
a
just
pretty
adding
thing.
insult to injury, because it's not doing anything to help you, really.
Actually, well, with the tincture of bark, yes.
Well, yes,
With
yes. I'm thinking
the
more of the
tincture,
bleeding and purging.
oh, the bleeding. Actually, here's the crazy thing with bleeding. And we've documented from His Majesty's Detached Hospital, the group that Mike and I are part of, that Mike helped start years back in the 1980s. We've actually documented medical practitioners, and I'm talking about in the modern era. So I'm talking 21st century, World War I, World War II, Vietnam, Korea. We've actually had one that actually did it in Afghanistan that actually bled.
Wow.
Now you're thinking, that's
Why?
barbaric. Why? Because blood is life. Okay. When you bleed a patient, and if the patient is experiencing fever, you're removing, and remember, we're removing approximately anywhere from 12 to 24 ounces at a time. So pint and a half, no big whoop. You're actually, what's happening is you're taking that blood, heat's going with it. It's going to actually cause your body temperature to drop. Hence why when you go to one of the Red Cross locations and you give blood, one of the things they do, they check your temperature going in because they don't want you to be sick and giving blood. But the other thing is they also want to monitor your blood temperature after the fact too, because they know it drops. So that's one area that, yeah, it could help. The other area, you say you had hypertension. Bleeding helps with that, because what's the body circulatory system? It's nothing but a big hydraulic system. You take fluid out, the pressure goes down. Now, is it going to rebuild? Certainly, reasonably quick, within a day especially. So you get those sorts of things. Then there's a third action. When the body starts losing that kind of blood, that amount of blood, body starts producing adrenaline, endorphins. The whole concept of the fight or flight type concept, the idea you're in an accident, you need to lift this car off your loved one, that kicks in. So not to the degree that you're going to be the Hulk, but to the degree that you're going to start feeling better. And that's why all of these factors, it made you feel better. And if it made you feel better, it worked. It's all symptom driven. And what we recognized in the modern setting, there were certain medications that they due to logistics, they had run out and they were not able to get supplies in, that they would use bleeding to control certain symptoms. And so
that's amazing.
That's that. I can't make this stuff up. I mean, it's amazing. And what really is amazing, and what's for us as historical interpreters, what really gets us excited is when you can take and put first person accounts with it, when you can actually talk to that person and understand, and he'll tell you why he did it, and you'll look at him and say, it makes sense. So yeah, all this is going on, but yeah, it's pretty gross and pretty, to some degree, some barbaric, but it did help control certain symptoms. The idea of purging, making you vomit, making you poop, we'll use a better term, especially for the younger people. You're getting at, if there's anything in your digestive system that's causing the illness, which it could be, because you've got this and you've got spoiled food you're dealing with. You've got water that may be contaminated. All of those facts, if you can get it out of the body may actually begin to recover. Hence why I've said in the beginning, they were figuring out that if you put the body in the right kind of environment, that it can actually heal itself. The human body is an amazing machine.
It really is. Now, in tomorrow's video with Mike Williams, I am going to go through a list of wounded members of Tryon's militia who submitted petitions several months after the battle. And in some of them, they talk about the nature of their wounds. And I was talking with Mike about how you would treat some of these. And as luck would have it, there is one non-combat related petition that comes in from a member of Tryon's militia. And I wanted to read that to you, and I wanted to get your thoughts on it. It's by a man named Alexander Curtis, and he was with the Craven Detachment. And he sent a petition to the assembly. He's asking for support because he said that he, quote, went out in that service in which, from his constant lying on the cold earth and being exposed to the inclemency of the weather, he contracted a violent cold that brought on him other disorders, which have reduced him to so low a state as to render him entirely unable to get his livelihood or sustain nature.
My gut guess is either he's dealing with bronchitis or he's dealing with pneumonia. Either one of those, and as someone, I don't know about you, but someone who has had um, uh, both, they will do exactly what he says. They will, and you're bleeding and purging. You're giving him tincture for the fever, and you're trying to work through. There are some other cathartics that you would use. There would be things you try to break up the phlegm with, different medicines. But I truly believe that that's probably what he was, and it makes total sense, because if you've been sleeping on the cold, hard, wet ground for days and you contract pneumonia, it can take you out of here. It will kill you.
Can it kind of stay in your system for a long
Well,
time?
it can be prolonged. It can be prolonged, and what happens is, you think about it, pneumonia. You might be able to get rid of the pneumonia, but how it affects it, it brings you to such, as he put it in his words, such a low state. It saps your strength. I watched my father go through it with uh, he developed it because he had a low immune system. And remember, all of these other external factors that you're dealing with, the cold and everything, affects the immune system. I watched him go through it. It took months for him to overcome the effects of pneumonia. We thought, 2 or 3 weeks. No, it literally took, I'd say, almost good 6 months for him to even begin to get back his strength and everything. And he had a pretty bad bout, but then he also developed lung cancer. So that was another issue. But watching the pneumonia, yes, it can do that. Yes. And bronchitis can too. Having been one that's had quite a bit of bronchitis as a young child, oh yeah, it could knock you silly. And so you're not, and see, the problem is in today's world, if we've got pneumonia or bronchitis, we get antibiotics. We don't have antibiotics yet, folks. We're not there. So we're using natural remedies that over time will work, and especially if you put the patient in the right environment and allow the body to heal itself, it will, but it'll take much longer. The other thing is you have an immune system that's been compromised, and it could allow you to get other diseases that could affect you. So it could take months.
It's a really fascinating aspect of this campaign against the regulators. And Chris, I really appreciate you joining me today to talk a little bit more about what those surgeons and surgeons' mates and nurses were doing at the Battle of Alamance. And it was a lot more than surgery. It was a lot more than battlefield medicine. It really encompassed a lot. So thank you for helping eliminate that.
You're certainly welcome. And again, thank you for inviting me to be part of your digital program this year. Hey, guys, when the pandemic is over and we can really get out and visit, I encourage everybody to get out and visit the Alamance Battleground site. Jeremiah and his staff are doing tremendous work. So my hat's off to you, Jeremiah.
I was going to say, Chris, you stole my line by saying, come visit Alamance Battleground, but I appreciate the kind words. I really do. And I can't wait for when we're back out in the field doing an event and you can have your whole surgical display and medical display set up. It's really great to see.
I'm looking forward to it.
Absolutely. All right. Thanks, Chris.
Thank you, Jeremiah.